is Anastasya Lapshyna. I'm aesthetic doctor and KOL of Innoaesthetics laboratory. Today we are going to have really very interesting topic for our webinar because we are going to discuss using of the exosomes, different kinds of protocols, indications, and so on. I guess you've noticed that exosomes are becoming more and more popular because really there are a lot of indications and we can implement them to our everyday treatments. So today we are going to discuss the exosomes in general, like basic information, what is that, all the process of biogenesis and so on. Also, we will discuss what you can find on the market of aesthetic medicine, what kind of exosomes, what is the difference, advantages and disadvantages of them. And of course, we will discuss the innovation of Innoaesthetics laboratory because these exosomes are unique, and also we will talk how you can use it and what would be the best way how to use it in order to obtain the best results in your practice. So, first of all, I would like to show you a video with the basic information about the exosomes.
We have got the key to a new horizon in skin regeneration. We will be the messengers that tell your skin to produce more collagen, elastin, and hyaluronic acid to produce youth. We will be the messengers that will tell your skin cells not to age. Exosomes are cell vesicles that transport information to other cells. This information acts as guidelines for the recipient cell. By carrying the right information, exosomes have extraordinary regenerative properties. They're extensively used in medicine for regenerative purposes. But what if we can also use exosomes in aesthetic medicine? To that end, our R&D department has been working for years on developing an innovative ingredient that possesses properties and a mechanism of action akin to exosomes. An exosome-like nanoparticle that effectively stimulates the synthesis of growth factors and promotes tissue regeneration. Only one vial of INNO-EXOMA contains millions of our exosome-like nanoparticles, granting it an extraordinary regenerating capacity. INNO-EXOMA, a new approach to facial rejuvenation based on exosomes.
So it's interesting that actually exosomes were found really a lot of years ago, around 50 years ago, but only nowadays they're becoming more and more popular, especially in aesthetic treatments. Because before, they were used in the classic medicine, and we will also discuss what can be the indications and purposes of use in medicine for different kinds of exosomes. But when the exosomes were used, like the scientists first thought that it's something that the cell is releasing, just like the product of the metabolism, or maybe something that the cell already doesn't need, like toxin or something like that. But of course, then they discovered that it's not like that, that the exosome is actually like the small copy of the cell. And they found out that the exosomes are used by the cells for the intercellular communication. Of course, after that, it became clear that the exosomes possess really a lot of properties like anti-inflammatory properties, immune-regulating properties, some stimulating properties, depending on the donor cell which was releasing the exosome, and also depending on the targeted cell. So what kind of communication we will have depend on both, on the donor cell and the recipient cell. In order to understand, or for example, to explain what are the exosomes to our patients, we usually refer to a very easy example that the exosome is actually like a message or a letter. So in case we want to send a letter to someone, we will put our message or information to the envelope. The same we have in the case of the exosome. So all the information that we have inside would be in the specific membrane, which will protect all that information and which can be transferred to the other cells. Also, we are usually indicating who we are, like from whom this letter is. The same can be with the exosomes, because on the membrane of the exosome, we can find specific markers that will show what was the donor cell, so what cell was producing that. And vice versa, we also need to indicate to whom we are sending that letter. So the same we would have in the case of the exosomes, because again, due to the specific markers, the exosomes would be very specific to specific cells. So for example, we can influence fibroblasts, we can influence melanocytes, keratinocytes, and so on. And of course, inside the exosome can be different kind of information. So inside we actually can find peptides, amino acids, growth factors, and so on. So the main properties which has the exosomes are regeneration and restoration of the tissues. Also, that can be regulation of the inflammation, stimulation of synthesis of collagen, of hyaluronic acid, of elastin, angiogenic effect, really a lot. And due to all these properties, exosomes really became a very effective tool in our everyday practice. So talking about naturally derived exosomes or human-derived exosomes, which are isolated from the mesenchymal stem cells, we have to understand that the exosomes can be revealed by or released by all the cells of the body. So that can be adiposive tissue, umbilical cord, bone marrow, dental pulp, and so on. So every cell can produce exosomes. But of course, it's much more easier to get exosomes from the fat tissues. It's easy to get fat tissue. It's really not some difficult treatment. We can obtain really a big quantity exosomes and so on. So how it is happening with the natural derived exosomes? We have a patient, we can have some quantity of fat. From that fat, we can obtain mesenchymal stem cells. And after that, after some time of the proliferation of the cells, they will start to release exosomes. So after that, due to the centrifugation, we can obtain the exosomes which we can use. And this is really very effective and great treatment and so on. But all this story is possible only in the case if the patient is the donor by itself, because we are not going to take the exosome from the one person and inject it to the other person. And of course, here we understand that there would be a lot of issues with such kind of treatment because it's rather expensive. It's we need to have a specific license in order to do such kind of treatments and so on. That's why it's not so easy, let's say, to obtain human-derived exosomes or exosomes which were derived from the mesenchymal stem cells. Why it's not so easy, and why we can't take the exosomes of the other person, or how these exosomes should be checked. So here you can see the biogenesis of the exosome, which explains all the process, and also understanding this process, we can understand that it's really crucial to know what kind of the cells we were using for producing of the exosomes and where this cell was taken. So here you can see a cell, and all the process of synthesis of exosome will start from the process of endocytosis. So here you can see like invagination of the membrane. And during this process of invagination of the membrane of the cell, it will take inside some substances which are located in that environment where the cell is located. So also pay attention that actually the membrane of the multivesicular body, of which then we will get the exosomes, is the part of the membrane of the cell. So this is how we have specific markers then after releasing of the exosome on the membrane of the exosome. When we already have, when the multivesicular body already exists, there would be the process of invagination of the substances that are located inside the cell. So after that, after the process of exocytosis, when the exosome will be released, we will have some substances from inside the cell, also markers from the cell, and some substances from the environment of this cell. That is why it's very crucial. Was this cell taken from the healthy tissues or no? What was the environment of the cell? Was it a damaged area, or that was the area of the inflammation? Because that will influence to all the messages that these exosomes will send to the other cells. That is why in medicine, those exosomes which are used, for example, for different kinds of treatments, like targeted treatments of the oncological diseases, such kind of exosomes which were derived from the mesenchymal stem cells should have a specific certification. So it's not just a cosmetics, it's not a medical device, this is not a medicine. That should be a biological product. And in order to get the certification for biological product, there should be conducted a lot of studies, checks of these exosomes, and a lot of time. That's why such kind of the exosomes are not used on the aesthetic market, or those which you can find on the aesthetic market, which are human derived. They're usually not indicated for injections, for transdermal treatment, so they can be applied just topically. But in any case, even with the topical application, we understand that always there is some kind of risk, because this is really a targeted system. This is really very effective treatment, and the exosomes also can penetrate. That is why never we can be sure that we will not stimulate anything that we are not going to stimulate while using the exosomes of the other donor, not that were taken from our body. And this is, of course, an issue, and it's difficult to use such kind of exosomes. Inside the exosomes, as I've already mentioned, there could be any information and any substances like proteins, peptides, nucleic acid, there can be lipids, and so on. DNA, RNA, so actually even some kind of genetic information also can pass from the cell to the cell. So that was the mechanism of the releasing and synthesizing of the human-derived exosome. But what we can find on the market now, with what are the exosomes, what are the difference between them? And first of all, again, these human-derived exosomes, which now we saw all the process of obtaining this kind of exosomes. But we are not talking about aesthetic market, let's say. We are talking about the treatment of really severe diseases like neurodegenerative diseases, oncological diseases. Such kind of the exosomes also can be used like the diagnostic tool through the liquid biopsies. It means that in order to understand, do we have, for example, some tumor cells or something like that, we don't need to take the biopsy like the part of the tissue. We can just take the liquid and search for the specific exosomes which were released by some kind of cells, and that will help us to understand what kind of cells there are in this area. Also, the exosomes can be used like the therapeutic use if they are naturally produced. This is that treatment which I've already showed to you if the patient is the donor. So in that case, we can get the exosomes of that patient and we can inject them for the treatment of different kind of inflammation. It's usually used in the cases of arthrology, for example, to treat arthrosis, arthritis, and so on. Or there are also therapeutic use of the modified exosomes. When we are obtaining exosome from the mesenchymal stem cells, but then we keep just the membrane of that exosome. We get rid of everything which was inside the exosome, actually all the information and everything which was stored inside, and inside we can put drug or a medicine. And that treatment would be very specific because we have that medicine in a specific membrane with the special markers that will be derived to the specific cells. So that would be actually a targeted therapy, which is also can be used in the cases of oncological diseases, neurodegenerative diseases, and so on. But again, this is not aesthetic market. We can't use it just for aesthetic treatments because most of the products don't have that kind of certification. Here you can see some companies which are producing this kind of exosomes. Most of them are located in the US. Also, there are some companies in Chile. But of course, this is really a great issue to use human-derived exosomes. There are a lot of risks. That is why now on the market of aesthetic medicine, you can see some alternative of the human-derived exosomes, and one of the most popular would be plant-derived exosomes. And on one hand, really, it looks like and sounds like more safe without any risk of any genetic information. But at the same time, there are a lot of questions with the plant-derived exosomes. And of course, the first one would be the question of the biocompatibility. So when I'm using human-derived exosomes, I understand that I will obtain the result of the stimulation of synthesis of collagen, of elastin, of hyaluronic acid, and so on. In the case with the plant-derived exosomes, we can't get the effect of the stimulation of synthesis of these substances. We cannot regulate their angiogenic processes, for example. Maybe we will get some anti-inflammatory effect because there are plants which possess all these properties, but it's not human-derived exosomes. So biocompatibility is the big question. Do really plant-derived exosome can get in contact with the human cells, with the human receptors, and really be stimulative? Also, there is the question of the toxicity and allergic reaction. With the human-derived exosome, of course, we won't have that problem because this is something very natural for us. This is something that we have in our body. With the plants, it is something from outside, something not very common for the body. That's why with the plant-derived exosomes, there could be some unexpected reactions, some toxic or allergic reactions. Also, there are a lot of questions about really the process of manufacturing, because there are no standards to manufacture plant-derived exosomes, and every manufacturer is having his own process, which usually they don't explain. For example, they don't explain how they count the exosomes, because you can find that they put information about the billions of exosomes in the vial, but if you will ask how you count them, there is no some kind of the process of quantity in them, of manufacturing them, and so on. Sometimes we are not sure there are really exosomes inside, or maybe this is the extract of some plant, and it is supposed that it should be some kind of or some quantity of the exosomes, but no one can explain in what way they really count them, or how they evaluate are these exosomes after all the process of manufacturing they're still active, for example, or what quantity of the whole quantity are active, and so on. As for the clinical trials, for example, or different kinds of articles, if you will look at PubMed, you will find very few information, around up to 10 articles, maybe even less. And all the clinical trials were conducted with the animals and usually with the oral intake of the exosomes, so we don't have information regarding their topical use or their injecting of them, and so on. So evidently there are more questions than the answers with the plant-derived exosomes still. Also, I would say that the efficacy of the plant-derived exosome is also the question, because if you pay attention to the products which you can find on the market, usually there is a vial with the exosomes and the vial with the product for the dissolving the exosome, for the reconstitution of the exosome. And usually the product for the reconstitution would contain hyaluronic acid, MAE, vitamins, amino acids, and so on. So in this case, I'm not sure what is actually working, this plant-derived exosomes or the product with which I'm reconstituting that exosomes. So really, there are a lot of disadvantages also in the plant-derived exosomes. Immune response, toxicity, really not targeted, not specific influence to the cells, question of the biocompatibility, and unknown effects that we can obtain. And taking into consideration all the disadvantages of the using of human-derived exosomes and plant-derived exosomes, Innoaesthetics Laboratory produced and manufactured their own innovative product, which is EXO-SKIN, which was produced with the help of NARBEX biotechnology, which is non-animal regenerative bioengineering exosome, which is actually 100% synthetic. If you or your patient don't like word synthetic, you can use a word, the product of biotechnology, which is actually very common for us because most of the products which we are using, like peptides, amino acids, vitamin, and so on, they are not naturally derived. Those kind of ingredients are usually synthetic, produced in the laboratories, and we are used to apply these products which are not of natural source, so this is completely normal. That's why, talking about EXO-SKIN, we understand that this is exosome-like product because this is not naturally derived exosome. But at the same time, this is copy or replica of the human-derived exosome. So if we will compare, or if we will take the human-derived exosome, especially those exosomes which are influencing fibroblast, for example, and this is the cell which we are mostly interested in the activating, because it will give us the result like synthesis of collagen, synthesis of elastin, hyaluronic acid, improvement of quality of skin, and so on. Then the EXOMA EXO-SKIN would be the replica of the human-derived exosome, but replica which was created in the laboratory. How was it possible? So that was possible with the NARBEX technology. And this is the specific technology when due to the changes in the pH, we can change the structure of the peptides. So inside the exosome, inside the INNO-EXOMA, we can find amino acids, signaling peptides, structural peptides, and even there wouldn't be just the ingredients which are inside. There would be really the vesicles, and these vesicles were created with the help by NARBEX technology by changing of pH. So with a specific pH, for example, when we have the low pH of the product, the peptides have the linear structure. But when we will gently make the pH higher, so in that case, then they would change the structure of the peptides and they would create a specific nanosphere. So there were questions about, do we really have vesicles inside this product? Yes, we have really vesicles because of the NARBEX technology and because of the changes in pH that can lead to the formations of nanospheres, which will consist of the peptides. So what we can find inside these exosomes or exosome-like products. That would be signaling peptides, proteins, amino acid, and structural peptides. Maybe the only difference with the human-derived exosomes that in this case we will not have the lipids, but all the protein structures would be the same as we have in the human-derived exosomes. So as you can see here, we have a vial with a lyophilized exosome, which is also an advantage because due to the process lyophilization, when we don't have a solution, you can be sure that like you don't have to worry about the specific way of keeping the exosome with a specific temperature, or you're not thinking about the process of transportation, how was that, and so on. So lyophilization is, of course, one of the advantages of this product. And you have a saline solution for the reconstitution. Inside the vial, we have 200 millions of exosome-like particles, or that would be 100 million per 1 milliliter if we will reconstitute the product in 2 milliliters of the saline solution. Here, we can explain how that was counted because they were created in the laboratory. This is not the process of extraction, so it's completely clear what quantity of the exosomes were produced. Usually there are questions about, is it possible to dilute it with a different quantity of the saline solution? So here you have to understand that the quantity of the exosomes in one vial, this is the quantity for the effective treatment of one area. So if you will reconstitute it in more than 2 milliliters, you will lose the concentration of the exosome. So per 1 milliliter, that would be less. That's why 2 milliliters is that quantity that we are recommending for one area. And if you want to work with the several areas, you have to take another vial of the exosomes. The active ingredients that would be inside exosomes are amino acids, which are the building material for the main proteins that we are interested in, of collagen, elastin, of some important antioxidants like glutathione, for example, and that would be lysine, proline, glycine, cysteine, and so on. There would be also amino acids that are very important for the regeneration of the tissues, restoration of the tissues, those amino acids which we need for the synthesis of filaggrin, which is the protein responsible for the natural moisturizing factors, some kind of tryptophan, for example, which is the precursor of melatonin. The other active ingredients which you can find inside would be peptides. There are 5 peptides, and most of them we need for the stimulation, of course, of synthesis of collagen. These are pentapeptide and dipeptide 7. Also, there is tripeptide 1, which is involved in the stabilization of the dermal matrix. Some like peptide, tetrapeptide 11, which stimulates turnover and growth of the keratinocytes, and also pentapeptide 5, which can be used for the acceleration of the hair growth. That is why INNO-EXOMA is the product that you can use for both, for skin and for hair treatment. In the case we want to stimulate the growth of the hair. The other active ingredients that we have inside are histones. Histones are very small proteins which are responsible for bindings between the links of the DNA. So actually, with the help of histones, we are obtaining some kind of epigenetic activity, as well as non-codifying microRNA is also the ingredient which possesses epigenetic activity. And this is the case where we can stimulate the expression of some kind of gene without modifying the DNA, and of course we don't have any kind of genetic information. So the main function of INNO-EXOMA EXO-SKIN as the natural derived exosome would be the same: the stimulation of the regeneration and the establishment of the intercellular communication bridges between different cells. Taking into consideration all the active ingredients and all the properties, we understand that there would be really a lot of indications for the using of exosomes. So first of all, we can use them in our anti-aging treatment, because we really improve quality of skin, we stimulate synthesis of important proteins, our natural hyaluronic acid, but also exosomes can be used in the treatment of different kinds of dermatological pathologies, especially those which are associated with some kind of inflammation. So that can be acne lesions, post-acne scars, rosacea. Exosomes are given really great results in the case of papulopustular rosacea, for example. That can be different kind of dermatosis and so on. And due to the peptide, we also can use it in the hair treatment. So in the case you are working with alopecia, in the case you are working just to stimulate the growth of the hair, INNO-EXOMA also can be used. So for the stabilization of the product was used lyophilization. That's why actually it is very easy to use, to transport, to store it. You don't need specific temperature. You just need to reconstitute the product before using. And after the reconstitution, you will have 24 hours to use that, which is also very comfortable. So you are doing that just before the treatment, before when you already have the patient in clinic. The process of reconstitution is very easy. You are just taking the saline solution to the syringe and put it to the vial, gently mixing, not shaking that, really gently mixing, because this is the product based on proteins. That's why we are doing that gently. Like this, and it's ready to use. So very easy. Treatment protocol that we are recommending would be 3 sessions with 21 days interval. Of course, this is like the basic protocol. Everything will depend on the indications and on the problematic with which you are working, but for the, let's say, 85% of patients, really 3 sessions with this 3 weeks interval would be completely enough. You already can get a very good result. And as we know that the product is sterile, the product is not of human origin, it can be used topically or through transdermal delivery systems like Dermaroller or Dermapen, for example. The protocol of treatment is very easy. So first we disinfect the area which would be treated, then we reconstitute the product, we apply it, and at the end of the treatment we are applying Innoderma skin repair for finishing the treatment. So here you can see the video with the protocol of treatment. The depth of the application can be different, so it depends on the indications. In this case, when we have a young patient without some severe symptoms of aging or any kind of dermatological issues, we are using that really superficially. The treatment is very comfortable, very easy. We are working with all the areas of the face, so also in the delicate areas like periorbital area, the exosomes can be used. The techniques, like here you can see stamping technique, also can be spiral technique, linear technique, as you prefer, and depending on the indications and skin of the patient. So in the case you are working with rosacea, for example, with very sensitive skin, you will be working more superficially with more gentle techniques. In the case we are working with them post-acne scars, for example, with a thick skin, with hyperkeratosis, then deeper application also can be used. So there is no significant reaction of the skin, there is no redness or irritation. And after application, we are just waiting for the full absorption, and we can finish the treatment with skin repair. the treatment for the face, finishing with skin repair, and of course sun protection. And here is the treatment which you can use for the trichological issues. Also very easy. Working with exosomes with the scalp. So again, here can be superficial application with the depth of around 0.2 millimeters. Mostly we're working with the problematic area, but of course not just with these areas, so the exosomes get applied all over the scalp, paying more attention to the hormonal dependent area or to the problematic area, and different kinds of techniques, stamping technique, linear technique. Is very easy, comfortable for patient, comfortable for doctor, without any kind of irritation, without the significant reaction of the skin. So the main advantages of the INNO-EXOMA would be, of course, completely safety. So here we are working with the product of the bioengineering. That is why it is free of any kind of human cells, any kind of genetic information. There are no risk of the allergic reaction or toxicity, because we are not working with the animal or mammalian derived exosomes or plant derived exosomes. They were produced with all the standards, GMP, with all the certification, the experience of the laboratory, which is more than 125 years. And of course, before the launching of the product, we conducted a series of clinical trials in order to show the efficacy of the product. So here I would like to share with you these clinical trials so that you can evaluate the changes of the skin in after 3 treatments. So all the patients that I will show to you had 3 treatments with 21 days intervals. And you can see really the changes of the skin. So first of all, this is them. Here really we can see the decrease of the lesions and improvement of the vascularization of the tissues. And what is also interesting, that exosomes are given really great result for the treatment of hyperpigmentation. So I wouldn't say that the exosome is the product of choice or the first product that you are going to use in the treatment of hyperpigmentation, but it was noticed that really the deposit of the pigment is much lower after using of the exosomes, and that's due to the anti-inflammatory properties. So in the case when we are having this anti-inflammatory effect to the chronic inflammation, we also can obtain really very good results in the treatment of different kinds of hyperpigmentation. So that's a great treatment which you can start with, for example, the treatment of hyperpigmentation, or vice versa. In the case you're working with the patient with whom you're not obtaining good results with using retinol or using, for example, meline, that for most of the patients you are getting really good results, but there are some with severe hyperpigmentation or hyperpigmentation with inflammatory etiology, for example, then the exosomes really can be a great tool for you, which you can add to your professional treatment of hyperpigmentation. So here you can see another patient, and again, even on these pictures, we can see that there is a significant lightening effect. Here you can see that the deposit of pigment is much lower after the treatment with the 3 treatments with the exosomes. This is also an interesting patient with a scar, and the scar is pigmented. So pay attention to the lightening effect. So here you can see that lightening effect is really great, just with the 3 treatments with the exosomes. This is a younger patient, so in this case, we just have superficially mimic wrinkles and maybe opened pores. So after 3 sessions of treatment with the exosomes, we have the decrease in the depth of the wrinkles, especially mimic wrinkles, and also less quantity of the opened pores, which you can see here. So it's also improvement of the quality of skin. Again, more even skin tone, improvement of quality of skin, some lightening effect, less depth of the mimic wrinkles, more even skin tone. So the results are really great. Also, I would like to share with you some results of the colleagues which already started to use INNO-EXOMA from all over the world. So this is the result of one treatment of the doctor from Dubai. So here you can see, let's say, complication after laser treatment, and just one session of exosomes with micro needling gave really great result. Here is the result of a doctor from the New Zealand, 3 sessions, and improvement of the quality of skin, really glowing effect, more firm skin, and the more even skin tone. The effect for the hands treatment, 3 sessions with 21 days interval, and we really can see the significant improvement of the quality of skin, less pigmentation. Here is also great result from the Brazil in the perioral area, working with the barcodes. And some results of trichological treatment. So even with 3 sessions, you can obtain really very, very good results. This is also a great case. Here you can see the result after 2nd sessions. But in general, there was conducted 3 sessions with 2 or 3 weeks intervals. So it looks really amazing. Now more and more doctors all over the world are using INNO-EXOMA, and while doing trainings in different countries, I already saw photos when doctors are sharing really their great results just after 3 sessions. There are different kinds, let's say, of protocols. So you can use this one, which is the classic protocol, but also exosomes can be used after some kind of aggressive treatment or very active treatment. So you can use exosomes, for example, after radiofrequency, microneedling radiofrequency. You can use exosomes after laser, and you can use it just topically because already you have some kind of traumatization of the tissues, and even using that topically will give you great results. So I really recommend you to try these exosomes, to take it into your portfolio of the professional treatments which you already have in clinic. I'm sure you will be satisfied with the results. Your patients also will be very happy, because this is really very effective product and giving you the results very quickly. If you have any kind of questions, please write them in the chat. Now we will discuss it. Maybe you already started to use it and you have some practical questions. Maybe you didn't use it yet and you want to know how to start. Any questions, or maybe you can share your experience if you already started to use that. Because I know that a lot of you are already using, so maybe if you will have questions after, maybe you will start to use it and you will understand that you need more information, you always can write to Skin Academy and we will provide you all necessary information. What is the key advantage of our exosomes compared to natural? The key advantage is that these kind of exosomes, INNO-EXOMA, is completely safe because we don't have any kind of genetic information and we don't have any risk of the stimulation that we are not, that we don't want to obtain, because naturally derived exosomes that exist on the aesthetic market is not the product that can be used with the help of microneedling, and is the product that doesn't have necessary certification. It was taken from another person, it was taken from another patient, and it is not possible to inject it, or even with the topical application, we understand that there is some kind of risk. That is why here, when we have the replica of the human-derived exosome, but which is totally synthesized and the product of bioengineering, the safety is, of course, the main advantage of these exosomes. Can you inject it? So the injection of this kind of exosome depends on the regulations in your country. So that's why me, like it's my my own experience. I do it like a mesotherapy, injecting that with a micropapule technique or Napash technique or something like that. Because I know that this is a synthetic product, the first, the second, the product is sterile. That is why, yes, I'm injecting. But if in your country strictly prohibited to inject such kind of products which are not CE, for example, registered as cosmetics, then in your case you can't, but actually it's up to a professional, up to you and the regulations in the country. As for me, yes, I injected that. I would like to know how we compare between exosome products, since we have many from Korea. Would you know how to compare this? So in the case of comparison, what is important for us? The first would be the source of the exosomes, how it was taken. I explained to you what are human-derived, I explained plant-derived exosomes, what are synthetic ones. So now you know the advantages and disadvantages, and you can evaluate and understand what is better for you. Of course, the synthetic exosomes or bioengineering exosomes are the most safe option. Then we can compare also the active ingredients, because like I've mentioned, sometimes there are exosomes and the product for the reconstitution, which is actually containing everything, vitamins, amino acids, peptides, and so on. So I'm not sure what is working, exosomes or the product with which I'm doing the reconstitution of that. Also, it's very important if the manufacturer can explain you really the process of obtaining or manufacturing or counting the exosomes. And if they can't, it's really weird. So sometimes I know, for example, the products which are like exosome product contains exosomes, but in the composition you will just find the extract of some plant, and extract of the plant doesn't mean that we have exosomes inside. So you have to evaluate all these things to understand if you are really working safe and if you are really will be effective. If patients were to use it as a topical product, must they finish using it within 24 hours? Or can they spread out the application? After the reconstitution, you have 24 hours to use that. That's why for the 24 hours there were conducted studies, so we can say that the product is really active and safe and so on. So we don't recommend to use it after 24 hours, but in one vial you have the product for topical use, only just 2 milliliters for one topical use. So you will reconstitute it just before using that. You don't have to do it beforehand. Is it safe for pregnant women? All the questions about pregnant women, about everything, peelings, mesotherapy, exosomes, etc., is a bit tricky question, because of course no one never conducted any studies and trial on the pregnant women. That's the first. The second, we understand that in the case of pregnancy, during the period of lactation, the reaction of the skin is completely different because we have some hormonal disbalances. That is why sometimes you even don't obtain that result that you are looking for. That is why in the case of topical use of the exosome or any kind of other really safe products, I don't see any problems. But would you get really good results in the case of pregnancy? Or from my opinion, it's much better to wait during the pregnancy, during the period of lactation. During this period, you have really nice topical products like Innoaesthetics, for example, of solving different kind of dermatological issues, and you will be completely safe. Because it's always like your responsibility when you are working with pregnant women. Is it okay to do microneedling every 2-3 weeks? Yes, that would be okay to do every 2-3 weeks. So we conducted all the clinical trials with the 3 weeks interval. But that is something average. So actually you can do the intervals between 2 or 4 weeks. I wouldn't recommend you to do it every week because this is really a very strong and potential stimulation treatment. Then 1 week wouldn't be enough, like an interval. 2 weeks is already okay in the case you want to do it a bit faster, in the case maybe your patient doesn't have a lot of time to come and so on. That's why between 2 and 4 weeks, that is the normal interval for the treatment with the exosomes. What are the contraindications? So and can we treat keloid scars? Well, keloid scars is actually one of the contraindications for every kind of invasive treatment of traumatization. That's why, because in the case of the keloid scars, we understand that the process of regeneration of the tissues is not going correctly. So we are having fibrosis instead of the normal neocollagenesis. That's why to use it topically in the case of keloid scars, let's say maybe it will help, but to tell the truth, I don't think that you will have really significant good results in the case of keloid scars. As for the injection for keloid scars, here is the question not of the exosomes, it's the question that injections are not allowed because any kind of traumatization again can cause the stimulation of this fibrosation. As for the other contraindications, would be completely the same as the general contraindications for microneedling, for example. So if your patient have any kind of acute inflammation somewhere on the face, like herpes or inflammation, like trauma, then we have to wait a bit, and after some period, so that can be used, but not in the acute trauma. In the acute trauma, by the way, you can use it topically. I'm now mentioning the contraindications for microneedling. So usually it's herpes, it's fever. So if the patient has any kind of other disease with a high temperature, then all kind of microneedling would be prohibited. And that's all. There are no some specific contraindications to the exosome-like product. This is, you saw the active ingredients, so this is actually the stimulation of our fibroblasts. And taking into consideration its anti-inflammatory properties, we understand that also it will be helpful in the cases of dermatosis, of some kind of dermatitis, like additional treatment. Any procedures that we do not recommend to be used with the exosomes, like skin pen, laser, sled, roller, etc. No, actually, even if you are doing aggressive treatment, even if you are doing all the treatments which are associated with the traumatizing of the tissues, after that, exosomes are recommended, but usually topically. So after some kind of traumatization of the skin with the radio frequency, with the laser treatment, and so on, you can use exosome, but just topically, not to traumatize it more with the microneedling, for example, and it will work because the exosome is like it will penetrate. It's really a targeted therapy, and the vesicle is the unique transportation system. So even when you're using that topically, don't worry that it will not penetrate or stimulate. That's why there are no contraindications like other treatments. Is exosome, which is plant-derived, safe? Camellia, truffle. Well, yeah, so the doctor was late and didn't hear the explanation about plant-derived exosome. Is it safe? If we are discussing transferring of the genetic information, then it's safe, because with the plant-derived exosome, you will not get any kind of human genetic information. So on this side, you are safe. But with the plant-derived exosome, there are questions of allergic reactions, questions of toxicity, questions of biocompatibility. Will these plant-derived exosomes really stimulate synthesis of collagen, elastin, angiogenesis, and so on? So maybe it will possess some anti-inflammatory properties like plants possess, but of course, this is not something very similar to our exosome. So really, do they really possess the stimulating properties to the receptors of our cells? This is the main question. And of course, it's not something very common for our body, for our tissues. That is why some allergic reactions, the risk of allergic reactions is higher than the synthetic exosomes or human-derived exosomes. A patient taking methotrexate for a rheumatoid can take it safely or not? What do you mean? Can you do treatments with the exosomes? If you are doing during the exosomes are actually even used in the cases of arthrosis, arthritis, any kind of rheumatological issues. So that's why I know some doctors, and I have also some experience of using the exosomes in the proaction of the joints, cartilages, and so on. So if you are using that topically or with the help of microneedling for such kind of patients, that also will be safe. How about exosome after Botox? So actually, I usually say that Botox normally should be the last treatment after all the treatments for regeneration that you've already done. Because if we are injecting Botox and then we are doing the treatments for the stimulation, so we are improving microcirculation in that area, then the longevity of the efficacy of Botox can be shorter. So of course it will not work like antidote for the buttocks, but I mean every kind of stimulation, even if you will do microneedling without any product, even if you are doing massages, everything that is stimulating microcirculation will make the period of the effect of the Botox shorter, because the muscles will regenerate and all these connections will regenerate faster. That's why my recommendation is usually to plan all your regeneration treatment, stimulation treatment, and so on, and only after to do Botox. The only exception can be when we are doing Botox, for example, in the mimic active areas, and then we are applying their filler. That makes sense. But if you are doing something really for the stimulation, then Botox should be at the end. But in the case your patient already did Botox and you have a question to do or not to do. So if the patient really needs some regeneration, improvement of the quality of skin, then we do that, but understanding that it's possible that maybe patient will notice that the effect of the Botox is not that long as it was before. That's the only unpleasant thing that can happen. That's all. What is recommended needle depth for microneedling for best absorption of the exosomes? Even the depth of 0.2, 0.3 millimeters would be enough. So in the case, if you even don't obtain blood, so you are not in the dermis yet, that's fine. The exosomes will work because the membrane of the exosome is very targeted, it's very specific, and this is the unique transportation system. So it will work. But why do sometimes I recommend to go deeper, to work, for example, on the depths on 1 millimeter or the depths of 2 millimeters in the case of the body? Because if you're working with the stretch marks, if you're working with the post-acne scars, with really hyperkeratosis of the skin, then also you are getting the effect not just from the exosomes, but also the effect from the needle, the effect of traumatization, because actually microneedling and every needle, that would be your negative stimulation. With the help of inflammation, you are stimulating keratinocytes, you are stimulating immune cells, you are stimulating growth factor, releasing of the growth factors, and so on. So here that would be a combination of positive stimulation with the exosomes and negative stimulation with the trauma that you have with the help of microneedling. So the average depth would be around from 0.2 to 0.5. And then in the cases of severe lesions or post-acne scars, then you can work deeper up to 2 millimeters in the case of the body, for example. What kind of problematics are exosomes best indicated for? What are the best results you've got with microneedled exosomes? The main indication would be any kind of aging processes. So when we need to improve quality of skin, when we have sagging skin, when we have wrinkles and so on, and also everything which is associated with the inflammation, because also the process of aging is associated with the chronic inflammation. And we have anti-inflammatory properties here. Talking about the other indications like mild acne, or second step of treatment of acne after you already performed some peelings and already obtained some anti-inflammatory results, but you need to work with the post-acne spots, pigmented spots, or some post-acne lesions, then the exosomes would be great. In the case of rosacea, it also works perfectly well. So I've showed the results, so you can see that we are obtaining really great result in trichology, in the treatment of hyperpigmentation, in the case just of the improvement of quality of skin. That's why we started today with the point that there are really a lot of indications for the exosomes. It is something that you can use almost for every patient. In trichology, in some kind of dermatological issues, for anti-aging treatment, and that's a great tool which you can implement also to your treatments while working with fillers, boosters, and so on. How much to wait between regeneration treatment as microneedling and Botox? So you just finished your last regeneration treatment, and more or less in 1 week you can do Botox. So this is again you already have done all the treatments with microneedling, with the stimulation of microcirculation. That's why after that, actually, even in a couple of days, you already can do Botox. That wouldn't be an issue. It just have to be after. Is there a maximum duration or time to stop exosomes? If with improvement noted still. To stop exosomes. So you already in most of the cases, everything, all the before and after pictures that I showed you today, that was the results of 3 treatments, and even one you could see the result of 1 treatment. So the average quantity of the treatments would be 3. But in the case you are working really with hard cases of alopecia, if you're working with the post-acne scars, which existed for many years, then not maybe 3 treatments will not be enough. So in that case, you can perform more treatments, and that can be up to again, dependent on the results that you are obtaining, but for example, more or less up to 6 treatments. The improvement, of course, still you can see after more than 3 treatments, because you are continuing stimulation. If you see that it's not enough in the case of this patient, then you can do more, and still the results will be better, depending on the problem also. Because if there are post-acne scars which are existing for many years, doing just exosomes will help a lot, but maybe it will not be enough. Maybe you also need to combine it with some devices. Maybe you need to combine it with some deep peelings in order to be more effective. Exosomes at maintenance treatment. Yes, you can use exosomes at maintenance treatment, especially with everything which is associated with inflammation. Like I've showed you the results of treatment of hyperpigmentation. So imagine that you already worked with some kind of peeling systems for the treatment of hyperpigmentation, and your patient is already on the home care for the treatment of hyperpigmentation, but you also want to stimulate some, to obtain some more strong anti-inflammatory result, then you also, for maintain the result, can use the exosomes. If you're working, for example, with some kind of stimulators of synthesis of collagen, there are a lot. Maybe you are using some other kinds that can be polylactic acid, hydroxyapatite calcium, and so on. So after that, you also can additionally stimulate the tissues with the help of the exosomes in order to have more vivid results, maybe faster results. That's why as a maintenance, that's great. As the also preparation for some kind of treatments, you are just going to to do some treatment of hyperpigmentation, or you are just going, you will apply, I don't know, fillers just for the volumization. But before, you can stimulate the tissues, so you can stimulate the process of building of the proteins, of building of collagen, of elastin. It will give you best results, and you will also get some anti-inflammatory results. That's why that would be great before treatment of hyperpigmentation, for example. If you have any other questions, please write in the chat. If you will have questions later, you always can write to Skin Academy, and we will share with you all the necessary information. You also can contact distributor in your country. They also can provide you information, or contact with us in order to prepare some information for you. Thank you for your time. I hope you've got some really useful information that you can use. I really hope that you will start to work with the exosomes, because the results which you will get will really be amazing. You will be happy with the results of the treatments. I'm sure that your patients also will be happy with the results of the treatment. And you also can share with us your results that we can after share, of course, mentioning you during our webinars, during our trainings, and so on. Thank you so much, and have a good day, and bye-bye.